right. So these are my credentials. Now, what are human resources and how do you maintain quality? It's very important for those of you who are practicing or plan to start practice, especially the small practices. You need to have a trained staff, technical skills, you must have task to skill matching, and you must be able to provide them training in the form of continuing medical education for your doctors if you're employing them, or for your technical staff. Now, it's very important to design a training program for your staff in such a way that they learn every day. Otherwise, normally what happens, either they get bored and they move on, or then they find that they're not able to adapt to newer technologies as you get them. Now, training opportunities should be provided so that the employees stay in the organization and they are able to keep abreast. Now, apart from meeting immediate demands, all employees have to be encouraged to take courses like these conferences that are likely to improve their prospects and more highly skilled employment. In America, the ASCRS runs the ASOA, which gives the training to the technical staff while you are having courses in ophthalmology. And we need to start that in India also. Now, there has to be a systemic means of assessment which should be used while you select your employees for training in your organization. Now, what is the purpose of training your staff on job? One is to render better service to the patients, reducing the wastage, filling the higher posts in your organization, and also for promoting safety measures. Some of them is not getting the wrong eye operated. These incidents have happened. Then the sterilization is very important. We've had eye camp disasters. Now, teaching employees how to efficiently operate new equipment. Imagine you bought a new OCT and it crashes. You could be having 2 weeks for the next technician to come and set it right, and you could be in a big soup. Also keeping abreast of newer developments, which you do in these conferences. Now, what are the advantages of training them? This brings about an improvement in the quality and quantity of the output by increasing the skill of your employees. Trained personnel can make better use of supplies, instruments, and equipment. Training helps to highlight promising employees, so they feel motivated. Training also helps in locating mistakes in the selection process. Supposing you've hired a doctor who doesn't have a good temperament, finds it difficult to face a patient, maybe he'll do better in the OR than putting him in the OPD. Training creates a feeling of security amongst the employees that they're properly looked after and they'll be here for the long period. Now, for human resources and to increase your volume, it's very important to have motivation for productivity, the right amount of number of staff, and the mixing of the staff. You know, who's to be placed for refraction, who's to be placed for how many you need, and so on. Their working hours. It's very important nowadays to have flexible hours. Good employees, by and large, leave now more because of the strenuous hours of working rather than because of pay. That is a study that's been shown, not in medicine, but in other fields. So you find a lot of multinationals are allowing employees even to work from houses, especially the ladies on the computer, online time, and so on. So it's becoming very important in healthcare that we have to be more flexible in our approach. And the job allocation. Job descriptions, the regular and seasonal, that's very important in ophthalmology, at least in certain parts of the country. In summers, the surgical volume reduces. But that is the time when the staff could be used for other work. Whereas in winters, you need to allocate more staff to the OR so that you can get the surgical work done. And your recruitment and selection has to be in a very streamlined fashion, and employee recognition and retention. These are two things which are very critical today. You train somebody for 10 years, then your competitor will hire him for 1,000 rupees more a month and you lose all that. So he's actually not paid for the training. You have. He's got the benefit. That's why he's paying more. So in brief, what I wanted to say, because the time is short, is that be very judicious with your staff. Treat them as a part of a team. Don't look upon them as an employer-employee relationship. Maintain the discipline, but at the same time treat them as a family. Overlook some of the shortcomings because you may not be able to get the next person to fill up the slot, and it's much easier to be able to work with those who are used to your style of working than training everybody new. If there are any questions, I'll be happy to take, while the last speaker would please come forward and start his talk. We have enough time after this for discussion, so if you have any questions, we'll be able to answer them. Thank you very much.